My name is Dr. Daniel Cook. I'm an anesthesiologist that invented, designed, and manufactured the airQ airway devices. The airway devices are soft mass laryngeal airways that were designed to be standard airway devices, but also to be used as rescue airways for intubation as an intubation conduit. Now, what I like to do is introduce a new airway device that I've designed and developed over the last 3 years, mostly for emergency medicine. But it's also designed to be used in patients that are higher risk for aspiration. And it's called the airQ blocker airway. Now, the airQ blocker airway has all the standard features that the normal airQ has, plus a few extras. What I'd like to do now is go over all the features that make the airQ a very unique intubation conduit and also a really easy airway device to use for standard ventilation. The first thing is it has a connector that's removable, and it has a strap that holds the connector on, so that when you remove the connector, the strap will hold it in place. Now, you use the removable connector if you want to intubate. It shortens the barrel of the airway device and opens up the airway tube so that you can put large bore standard endotracheal tubes through. You can use regular endotracheal tubes right off the shelf and up to a size 8.5 with the largest airQ blocker. The next thing you'll notice is this very large area here that has increased amount of plastic we call a bite block. It's not the standard bite block, it's not rigid, it's very soft and movable. So it won't injure the teeth and won't injure the hard palate, but it's very effective at keeping the patient from occluding the airway during biting. I call it a functional bite block. So it allows the patients to bite. It makes it very difficult for the patient to occlude the airway. The second thing you'll notice is the hypercurved airway tube. The hypercurved airway tube is anatomically correct, so once the airQ is in place, the airway will be very stable and will resist kinking and will resist rotating. You also notice on the side a soft, what we call the guide tube. And what I found out is if you put stuff in this guide tube, it'll follow the bottom of the mass bowl right into the esophagus. So this guide tube allows you to access the esophagus while the airQ is in place. In a little while, I'm going to explain what we use this guide tube for. The next thing you'll notice is it's got a beefed up heel balloon. That balloon seals into the vallecula area and helps seal up the airway so that it makes it very easy to move air. It has a very large bowl and a tunnel. The large bowl allows me to drop the larynx into the bowl of the device and center the larynx. It becomes important for ventilation, but it's also really important to make that alignment for intubation. And the tunnel deviates the epiglottis and puts the epiglottis on top of this ridge. By deviating the epiglottis and putting it in an upward position, it stabilizes the internal structures so that you don't get herniation to the mass bowl. It's a little bit like a little guy in there with a straight blade, holding up the epiglottis, stabilizing the anterior structures, and opening up the inlet so that you have a direct conduit to breathe through. It also makes it important because you also have a direct shot into the glottis for intubation. These three little horizontal ridges will push up against the bottom part of the arytenoids and help block off air going into the stomach and also aspiration going into the bowl. It also acts as a lateral stability section so that the airway doesn't collapse when it's in the patient. So all these features maximize the conduit to breathe by opening up the inlet and stabilizing the anterior structures and allows you to comfortably and ventilate patients. It also makes it much, much easier if you want to use the airway as an intubation conduit.